Good afternoon, everyone. First, I'd like to say that this webinar is being recorded and we have time after the presentation for questions. Thank you for joining us again this afternoon. My name is Bamidele Osamika. I'm the Regional Climate Collaborative Manager at Green Umbrella. Green Umbrella is the Regional Climate Collaborative Manager. Green Umbrella is the Regional Climate Collaborative for Greater Cincinnati. We have been serving as a backbone for environmental and sustainability work for the past 25 years for Greater Cincinnati. Over the years, we've connected hundreds of members, local government, nonprofit, businesses, academic institutions, as well as passionate individuals through our collective impact approach to tackling the most compressing and pressing issue that our community faces. Next slide, please, Novi. This webinar series is titled Climate Change, Air Quality, and Health Outcomes in Greater Cincinnati. This one-hour webinar hopes to explore the connections between climate change, air quality, and our health outcomes within the Greater Cincinnati. Our panelists will make a brief presentation followed by Q&A. We will wrap up with the next steps and some announcements. Next slide. Next, please. Thank you. So with the recent change in Green Umbrella identity from Regional Climate Sustainability Alliance to Regional Climate Collaborative, Green Umbrella joins more than 30 other climate collaboratives across the country, all of them working across jurisdiction of climate actions. And given our staffs and existing programs and a partnership that we have built over the past 25 years, we are now the largest regional climate collaborative within the country. Green Umbrella serves 10 county regions across Southwest Ohio, Northern Kentucky, and Southeast Indiana. Myself, Nobi Kennedy, who's our regional climate coordinator, and Savannah Sullivan, who's our senior director of programs and climate strategy, are the three primary staff members supporting our climate equity work. Alongside is our climate health fellows, who is Mitch Singston, a fourth-year medical student, and also Leah Rose, who is also an undergraduate medical student, both at University of Cincinnati. The Climate Health Equity webinar series built on the recently completed reports done in partnership with Scioto Analysis to highlight the findings of this report and accelerate the key actions related to the key topics that were discussed on the report. We have released a public service announcement toolkit that is connected with these topics that's covered in this webinar, and also other shareable materials that we'll be sharing through our social media platform. Please log into our social media platform to read the reports in full. Next slide. This public service announcement campaign will cover climate topics, 11 of different topics, one per month. And today's webinar is the 7th in this series. This campaign provides data and also shareable media materials every month. Additionally, this campaign also provides some of the strategic steps that individual institutions, as well as the system level, can take in tackling the most compressing issue in our region. This month's public service announcement covers climate change, health, air quality, and also health outcomes in Greater Cincinnati. Next slide, please. Do you know that climate change increases levels of air pollution? that make it harder for us to breathe. It becomes worse for individuals who have history in respiratory illness, such as asthma. These adverse health effects affect air pollution and tends to hurt minority groups and those with lower socioeconomic status. Then what can we do? What can institutions do? We can all improve our air quality by driving less and using more sustainable vehicles. Most air pollutants come from burning of fossil fuels. Burning less greenhouse gases will not only improve our air, but also improve our health and also make us have a healthy community. Local businesses and governments can improve indoor air pollution by making sure that they have equality efficient buildings that has a very less of fossil fuel burning. They can also complete an energy audit to identify ways to minimize energy waste. Please join us in 2030 district programs and also utilize some available incentives to create an efficient building. At this junction, I would like to introduce our guest speaker, who will dissect the topics and be ready to answer some of the questions that we'll be having. Our panelist is Dr. Patrick Ryan. Patrick is a professor of Pediatrics and Environmental and Public Health Science at Cincinnati Children's Hospital Medical Center and also University of Cincinnati College of Medicine. He obtained his bachelor's degree in mathematics at Xavier University and also master's and PhD degrees in epidemiology from the University of Cincinnati, Department of Environmental Health. In 2013, he joined the faculty of Cincinnati Children's Hospital, Children's Medical Center, and currently serves as the Associate Director for Research in the Division of Biostatistics and Epidemiology. He's also a director of a graduate program in clinical and translational research, and director of translational workforce development for the Center of Clinical and Translational Science and Training. Dr. Ryan's research integrates exposure science with epidemiology to study the impact of environmental exposure and social determinants of health, including air pollution, community resources, green space, and others on respiratory and neurodevelopmental health outcomes in both children and adults. Please join me as I welcome Dr. Ryan for his presentation.
Well, thank you, and thanks for the invitation to be here this afternoon. We can move on to the next slide. I think we've looked at my picture enough. And we'll do one more, please. So I just wanted to start off before we zoom in on Cincinnati to give a sort of a big picture look at the burden of air pollution globally. Air pollution is one of those environmental exposures that really is ubiquitous. We all are breathing some level of air pollutant every day. And the levels change depending on where we are and what's near us and the general air quality of our local areas. Globally, in 2015, PM 2.5, particulate matter less than 2.5 microns in diameter, was the 5th ranked mortality risk factor, with more than 4 million deaths attributable to exposure. And what I like to point out when I talk about air pollution and some of these global health risks and really large risk factors for disease is that these estimates of burden really are based on things like death due to cardiovascular disease and COPD, lower respiratory infections. But when we think about the burden of air pollution exposure and what I'm going to talk about today in Cincinnati, the burden really extends beyond these outcomes to things like asthma attacks or things like premature births because of high air pollution exposure, or mental health outcomes, exacerbation of anxiety among kids. So I would argue that the burden of disease attributable to air pollution exposure extends even beyond what are already very large numbers. We can go to the next slide, please. So everyone, I think, on this call is probably familiar with the Cincinnati region. We have about a little more than 2 million people in the overall area. And we have some interesting air pollution sources here. We have major interstates that transect the area, 71, 75. We can get more than 10 million trucks a day or a year on our regional highways. And some segments of road can get over 60,000 diesel trucks a day. In addition to the traffic sources, we have industrial point sources, things like coal-fired power plants, although as those close, those are becoming less of a major source of air pollution in our area, but we still do have several in the Ohio River Valley region that contribute to the air quality in our area. And the overall geography and climate of our region also can cause us some problems. Hot, sunny days, we'll talk about ozone a little bit, but hot, sunny days contribute to high levels of ozone in our area as well. So the things that we typically think of as far as air quality concerns in our region are PM 2.5, ozone, and traffic-related air pollution. Next slide, please. So just a few definitions of what I'm talking about when we talk about PM 2.5, traffic-related air pollution, and ozone. So PM 2.5 stands for fine particulate matter, less than 2.5 microns in diameter. So if you think of a human hair is about 70 microns in diameter. PM10, which is another size fraction of particulate matter regulated by the US EPA, is about 1/7 the width of a human hair, and 2.5 microns is about 1/30th roughly of a human hair. So very, very small particles. And the reason we are concerned about small particles for health is that the smaller the particle is, the lower into the airway that it penetrates and can deposit. And in fact, some of these particles are so small that they can translocate into the circulatory system, directly cross the olfactory bulb, and impact the brain. And so I'm going to talk a little bit about mental health outcomes and the work we do looking at air pollution exposure and mental health outcomes. And that's the reason why we think that some of these small particles can actually contribute to adverse neurodevelopmental outcomes in kids. In 2020, the American Lung Association had us ranked as the 14th worst. I saw that we were still not doing so great in the 2024 rankings in the introduction. So for a city our size, we actually have some significant air quality concerns that we're dealing with. The term traffic-related air pollution, you might hear me talk about that or others talking about that. That's not a specific pollutant, but it refers to the complex mixture of pollutants that's produced from traffic sources. So when you burn diesel and gasoline, it produces all sorts of things, including particulate matter and elemental carbon, but also nitric oxides and volatile organic compounds and polycyclic aromatic hydrocarbons and metals. And the study that I'm going to talk about a little bit today really was focused on diesel exhaust particles for a number of reasons. But diesel exhaust is one of those many pollutants that we've referred to as traffic-related air pollution. And then the other air quality concern that we deal with here in Cincinnati is ozone. And ozone is not a primary pollutant, but it's what's referred to as a secondary pollutant. And that's because it's formed in the atmosphere by chemical reactions from precursors, those precursors being VOCs and oxides of nitrogen oxides. And when you cook those up in hot temperatures with sunlight, it forms ozone. And we get high ozone days. Next slide, please. So here in Cincinnati, we have one of the longest lasting, largest birth cohort studies that's looking at air pollution exposures and the development of allergic diseases and asthma, and also neurodevelopmental outcomes in kids. And that's called the Cincinnati Childhood Allergy and Air Pollution Study, or the CAPS cohort. This study was originally formed from kids who were born in 2001 to 2003. We originally enrolled 763 infants who lived either near, meaning less than 400 meters from a major road, or far, more than 1,500 meters from a major road. And so here in Cincinnati, we define those major roads by truck counts, and it turns out they're basically 71, 75, 275, the lateral, and Ronald Reagan. And we followed those kids now, and we're continuing to follow those kids who are now young adults. for the development of allergic diseases, asthma, and adverse neurodevelopmental outcomes. We've done lots of data collection on these kids. We've published almost 200 papers. I'm not going to go through all of them today. I'm just going to hit a few highlights. But one of the unique aspects of this is the length that we've been following those kids, the size of the cohort, and all of the data that we've collected. So we've done home visits. So we've looked at indoor exposures like molds. We've done study visits. We have lung function data. And we've also done quite a bit of air sampling in the region and come up with a number of air pollution models for our region. Next slide, please. So here are just some pictures of results that we've looked at. The table that you see on the left is looking at the relationship between early childhood, so first year of life, exposures to elemental carbon. So elemental carbon is a marker of diesel exhaust. And what that data is showing there is that as you increase the level of exposure to elemental carbon that we have in our region, there's an increased risk for infant wheezing. So the outcome in that analysis was infants that were wheezing prior to the first year of their life, or in their first year of their life. And the median exposure here in our Cincinnati region is about 0.4 micrograms per cubic meter. And you can see at 0.4, those kids have about a 50% increased risk for wheezing. So a significant relationship between early childhood exposure and wheezing in the first year of life. And we followed those kids out now for again, more than 20 years. The data you're seeing on the right-hand picture is the risk of developing asthma as a function of exposure to air pollution over various times of the child's life. And so because we follow them longitudinally, we can look at what was their exposure in the first year of life, the second year of life, the third, and what's their cumulative exposure. And what we saw was it's those exposures that are occurring early in their childhood when the lungs are developing, when the immune system is not yet fully formed, that seem to be the most relevant for the risk for going on and developing asthma. So this was actually one of the very first studies that showed that exposure to air pollution wasn't just a contributing factor for the exacerbation of existing asthma, meaning on a bad air quality day, kids are more likely to go to the hospital because they're having an asthma attack. But we actually are seeing in this study with this data that the longer the kids are exposed and the higher levels of air pollution they're exposed to early in their life, the more likely they are to go on and actually develop asthma, so new onset asthma. Next slide, please. I've mentioned a couple of times the relationship between air pollution and the central nervous system, and I think this outcome isn't as well known perhaps as respiratory health effects, but there are reasons that we think that air pollution like particulate matter, PM2.5, and even some smaller particles that we call ultrafine particles can impact the brain. One being a direct mechanism. These particles are so small that they can actually cross into the circulatory system, cross the blood-brain barrier, and also be directly absorbed through the olfactory bulb in the brain. But also indirect mechanism, meaning when you breathe air pollution, your body doesn't like it and it produces an inflammatory response. And that's why you get things like cardiovascular outcomes, respiratory outcomes, and the brain is similar. The brain actually produces inflammatory responses to air pollution exposure. And you can see in this picture a number of the basic science and toxicological studies that have now looked at all of these different types of inflammatory markers that are upregulated in the brain when people are exposed to air pollution. And so we are interested in how those kids in our CAPS cohort who are exposed to higher levels of air pollution may have adverse neurodevelopmental outcomes later in their life. So next slide, please. So this is some data from a paper we published about 10 years ago now. But what we did in this analysis was we looked at the kids that were exposed to the highest levels of elemental carbon. Those are the diesel exhaust particles. And the outcomes here are externalizing behaviors, things like ADHD-like behaviors. And what we saw was that the kids who were exposed to the highest levels of air pollution, again, in the very first year of their life, when the brain is developing, the neurons are forming, the highest levels of exposure were significantly associated or linked to increased behavioral problems, especially things like hyperactivity and conduct problems later in life. And then this was when the kids were at age 7. So if you, next slide, please. We followed them on and we looked at when they were at age 12. And again, now we're looking at things like internalizing disorders like anxiety and depression. And what we saw here was pretty striking. Across the board, significant associations between the highest levels of air pollution exposure early in your life, early in the children's life, and the risk for symptoms of depression when they were at age 12, and also symptoms of anxiety. And what you can see in this figure, what this is showing here is that all of those estimates of the association are above 0, meaning that the higher the air pollution exposure was early in their life, the more at risk they were for having higher anxiety scores on our outcomes. And so, next slide, please. We've also looked at actual structural and functional changes in the brain. So these kids have done MRI, magnetic resonance imaging, with us at Cincinnati Children's Hospital. And what we saw, again, was corresponding to that increased level of anxiety symptoms and depression symptoms. We actually see a reduced cortical thickness in certain areas of the brain with higher levels of air pollution exposure, and actually less gray matter volume as well. And now this has also been seen with other studies in other areas in the United States and also in Mexico. And so we do see both symptoms of anxiety and depression being associated with higher levels of air pollution and exposure, and a corresponding changes in the structure of the brain in these kids. Next slide, please. So this cohort I mentioned has been going now since 2001. And we're continuing to follow these kids. We're following them under a new study that we call the Cincinnati Combined Childhood Cohort, or the C4 cohort. And what we're doing is actually merging the CAPS cohort with another cohort of kids here in Cincinnati called the Home Study. And the reason we're doing that is we can really increase the sample size that we're looking at. We can also look at various parts of the city that weren't included in the CAPS cohort. And we're looking at how air pollution exposure in both of these cohorts throughout their childhood, beginning in birth, all the way up till they're now 22, 23 years old, how that air pollution exposure is related to the incidence and the persistence of mental health outcomes that we know typically have an onset around that age 12, but certainly continue through young adulthood in our outcomes. So that study is ongoing, and we'll have more to share with that about that study in the coming years. Next slide, please. So I also wanted to talk about how short-term exposure is related to mental health outcomes. And the two pictures you're looking at here are maps of Cincinnati and overlaid with estimates of air pollution exposure that come from my colleague Cole Brokamp's models of PM 2.5 exposure. And I won't go into a whole lot of detail on how those models are developed, but I'm happy to if people have questions. But the idea here is that air pollution levels, we probably know, change day to day, and they also vary spatially. And so what we were interested in looking at is, just like in asthma, where you will see after air pollution increases, there's a bad air quality day, there's a risk for kids coming into the hospital because of asthma attacks. That's an acute or a short-term exposure that's related to an adverse health outcome. What we wanted to look at was, kids come to the hospital quite a bit for exacerbations of mental health outcomes. And what we wanted to do was we wanted to see if these types of models, where we can actually estimate how much air pollution a child was exposed to on a specific day, was associated with the risk of them coming to the hospital for an exacerbation of their mental health outcomes. And so next slide, please. So it turns out that there was a relationship. So the data that I'm showing here on the table on the left is just a description of the number of kids that came to the Cincinnati Children's Hospital emergency room from 2015 to 2019, so a 5-year period. You can see more than 13,000 emergency department visits for some sort of psychiatric exacerbation. You can see the different types of the causes of those. But what you're seeing on the figure on the right, everywhere you see a red arrow, what that's saying is day 1, day 2, and day 3, that's the relationship between the air quality the day before the hospital visit and the risk of coming in the next day for an exacerbation of a mental health outcome. And so, for example, if you look at the externalizing disorder panel there, you'll see that there was a significant relationship between high air pollution exposure 1 day before the child showed up to the emergency room for an exacerbation of that outcome. Suicide, similarly. So an attempted suicide, we saw a significant association between an increased level of air pollution exposure the day before the attempted suicide, and also adjustment orders and all causes. So we did see evidence of these acute exacerbations of an existing mental health disorder with higher levels of air pollution exposure. Next slide, please. So I'm going to switch gears a little bit. That was sort of a very quick overview of lots of epidemiology studies that we've done for the last 2 decades now or so in the CAPS cohort. I want to talk a little bit more about local and personal air quality and some of the things that we use and some of the tools that are available to communities to look at how local and personal air quality varies. And so one of the exciting things that has happened over the past 10 or 15 years is the increasing availability of low-cost air monitors. There's a picture of just 2 of them. The top one is a device called the Air Beam. It measures PM 2.5 in real time. It's a wearable device. It links to your cell phone to an app. And it'll allow you to actually look at what's the PM 2.5 that I'm experiencing when I'm wearing this device or carrying it, clipping it on my backpack. The device in the bottom is a Purple Air. It's called a Purple Air monitor. Very, very similar technology, but it also is able to measure PM 2.5 in real time. And you can put those devices outside or inside of your home, and you can measure the air quality in areas that are not, or in the past haven't been measured with EPA regulatory monitoring networks. And so what it allows us to do is start to what we call fill in the gaps. So we know air quality varies, can vary quite a bit over short distances. And there's only, a few EPA regulatory monitoring sites in any given area. So what we can do with these low-cost sensors, and what people can do if they're interested in the air quality in their neighborhood, is put those up outside of their homes or outside of businesses in their homes and look at what the air quality levels are in their neighborhood and what they're experiencing. So next slide, please. So we've done that in a few projects. One of them is with our partners, Groundwork ORV in Lower Price Hill. And probably everyone's familiar in this call with Lower Price Hill. But what we did was we deployed 12 of these Purple Air monitors in the Lower Price Hill area at locations that were identified by Groundwork and by their partners in the community, and really take a look at what does the air quality in Lower Price Hill look like when we compare it to the measurements that the US EPA is providing at their regulatory monitoring networks. And so if you go to the next slide, there's a lot of data here, but I'll try to distill it down. So what this allows us to do is this table that you're seeing here is the name of the locations of our Purple Air monitors in the Lower Price Hill area. And the first column of that data, what we've done is we've subtracted the EPA for every day of our sampling. We subtracted what the PM 2.5 air quality index value was from the air quality index value of the Purple Air monitor in Lower Price Hill. So every number that's greater than 0 means that the air quality index in Lower Price Hill was higher than the air quality index at the US EPA sampling site. And so you can see that for some of those sites, on average, for example, at the community manager site, it was 4.6 points higher. The AQI was 4.6 higher than the US EPA site on Taft Road overall. So the next column is just statistical testing. So every one of those that you see highlighted means that we did see statistically a difference, a much higher value in Lower Price Hill compared to the US EPA monitoring site on Taft Road. And then the third column, we looked at how many days would there have been an air quality alert in the Lower Price Hill neighborhood if we were using the purple air monitors that were not declared air quality alert days based on the EPA monitoring data. And what you can see was there was about 4 to 6 days where the air quality in Lower Price Hill was high enough that it could have triggered an air quality alert when there was not one, because the air quality at the Taft site didn't reach that same level. So that's some of the power of these low-cost sensors to really dig in and hone in on specific regions and look at air quality in specific regions in neighborhoods in Cincinnati and elsewhere. Next slide, please. This is another example of a partnership that I and others at University of Cincinnati have worked with Dana Bull and group in Norwood called Keep Norwood Cool, where the goal was to look at local air pollution and temperature hotspots, particularly with a focus on impervious surface and lack of green space. And what does that mean for very small, what we call hotspots, localized area of higher temperatures and higher air pollution levels? And so this project, we used those air beam devices, and we actually asked, our community partners led this, they asked people, residents of Norwood, to walk very specific routes through Norwood and map what the air quality and temperatures looked like in those areas. And so you can start to hone in, even within a neighborhood, on specific street corners, for example, or areas surrounding schools, that the air quality might be worse or the temperatures might be higher. And then we can start to focus in on why is that and what can we do about it. Green space is one example. If we remove some of the impervious surfaces, replace it with trees, that's one way that we can improve air quality and lower temperatures. Anti-idling policies around schools, things like that. Next slide, please. So I know that was an overview of sort of very quickly some of the projects that we have in Cincinnati, looking at air quality and health outcomes and community engaged work that folks are doing. I just wanted to sort of wrap up with putting it back in the context of climate change. So what does climate change mean for these exposures? Well, we know that air pollution is bad for you. We know that it's bad for respiratory outcomes, cardiovascular outcomes. I would argue mental health outcomes, although the research is still growing in that area. But we know air pollution is bad for you. What's climate change going to do to us? Well, for one, we expect particulate matter to increase. One reason is wildfire smoke exposure. And I think that was an example was last summer with the large wildfires occurring in Canada that was due to the winds transporting the particulate matter across the eastern United States, and Cincinnati was no exception. And I actually have a picture, I think, on the next slide from Cincinnati. If you were here last summer, you probably recognize some of those days where you could even see it. The haze was out there because of the poor air quality, the high levels of PM 2.5 due to those wildfires. And as we increase the frequency of wildfire smoke exposure, it's not just a problem for California and the Western United States. It's a problem for the entire country because of those long range transports. Secondly, increased energy consumption. So as temperatures increase, we all turn our air conditioners up a little more, we run them a little bit more, and we have increased power consumption. And we see those types of relationships also. Ozone, I didn't talk much about ozone, but ozone, because of the way it's formed, you need sunlight and high temperatures. And as we think about increasing the duration of the year, having high temperatures in March isn't going to be uncommon in the future, and even into November, for example, in the future. So the more days we have high temperatures, the more likely we are to have ozone problems. And so that's certainly something that we have to think about in the Cincinnati region. And then the other thing is allergens. So a lot of the relationship between air pollution exposure and especially the asthma and the respiratory outcome is also a function of how air pollution and interacts with allergens. So ragweed, for example, we're about to get hit with ragweed here in the next month or so. And it's actually interesting. You can see a relationship between increased levels of CO2 in the atmosphere and those types of plants actually having increased allergenicity. So the reaction that they produce is actually going to get worse as climate change increases, or CO2 levels increase due to climate change. The concentrations are getting higher. The pollen season, just like ozone, the pollen season is extending into the earlier spring and later falls. And then we also have flooding issues. I didn't talk about it in this talk because we're focused on air quality, but we've done some work looking at flooding and what it means for sewer overflows and the relationship between sewer overflows and health outcomes here in the Cincinnati area. So certainly climate change is going to impact those relationships as well. So next slide. So I think this is where I'll end, and happy to chat and talk, take some questions if folks have. But I just wanted to sort of end with a few photographs. The first one was Cincinnati in 1945. You can see some of the air quality issues. I mean, you can visually see the air quality issues, and 2019 in India and other areas in Asia are having major air quality issues. But it is localized here in Cincinnati as well. And so you can see that was a picture of Cincinnati from 2023 during the wildfires. And you can visually see the haze and the particulate matter pollution that occurs. So I think that was it. Next slide. I just, this is not an exhaustive list. I just want to make sure that I thank all of the folks that are involved with these studies at Cincinnati Children's Hospital, at the University of Cincinnati, and all of our work is supported by the NIH and the National Institutes of Environmental Health Sciences. So that was where I was going to end. I'm happy to chat, take questions if anyone has anything they'd like to talk about.
All right, Dr. Patrick, thank you for your presentation. The most very informative to us, and we really appreciate that. So we're gonna be, have time for Q&A now. So, and I'm gonna start with few ones I have here, while others while the audience sending some of their questions into the chat room. So one of it here is that what can individual or vulnerable populations do to reduce exposure to poor air quality?
Well, I'll start by saying, I mean, the most cost-effective and the best thing we can do is a big picture, reducing sources of exposure, because that's the way to reduce it for everybody equitably. And in the absence of that, there are things you can do on a local level, and there are things you can do on a personal level. So local levels, city governments have says in where things are located and where traffic goes. We did, I mentioned briefly, several years ago, we did a study with the Cincinnati Public Schools and showed that air quality at some of the schools, because of idling buses, was pretty bad. And if you do an anti-idling campaign, and then we measured the air quality at those schools, it significantly improved the air quality. So even on a local level, at a school district level, or even just a local one school, reducing idling is effective. On an individual level, I think I actually saw a question in the chat related to this also. Air filters are effective. HEPA filters do reduce exposures inside the home. They clean quite well. But even low-cost air filters can be effective. So there are, and I'm happy to share, you can Google it as well, ways you can turn box fans and furnace filters into low-cost air filters that are, not very expensive, and they actually have very good cleaning properties and clean as well as some of the commercial available filters. So that is another way. Masking can be one way. Pros and cons, and not necessarily a solution for everyone, but masking is another option as well. So there are things that we can do on a personal level. Avoidance, and that's one of the things about personal monitoring. You can learn where you happen to be exposed more often, whether that be, you take a walk at a certain street corner that seems to have bad air quality, maybe avoid that area. And try to minimize your own personal exposures is also another option.
Great, thank you for those answers. The other question, I'm going to pick one from the chat room, is whether you've used some of your data and to work with local governments and to reduce air pollution.
Yeah, I think that the two examples, the one is the idling policy. The other example was actually, oh man, in mid to late 2000s, when Governor Vojtovich was governor, he did use our data on diesel exhaust particles to push forward retrofits of diesel buses. And so I think that's a good example of options for trying to reduce the exposures to kids from diesel buses due to our policies. There are studies going on now of what the electrification of vehicles might mean for exposures. And there are pros and cons for those electrification of vehicles. They still produce particles because of tire wear and resuspension of road dust. And we're trying to figure out now, researchers are trying to figure out now what that means for air quality versus air pollutants that are actually produced by the burning of the gasoline or the diesel in the vehicle. So that's an open area of investigation as well. And then I also, I'm sorry, I'm looking at the chat too as it pops up, and I saw a question about cool pavement or green infrastructure. And I should have mentioned that back also in things that local governments and policymakers can think about is increasing the green space, especially for temperatures, but probably for air pollution as well. There is some data to suggest that physical barriers can help reduce air pollution levels in certain neighborhoods. So for example, if there's an interstate and a neighborhood next to the interstate, you put a physical barrier, whether that be a noise reducing wall or lots of trees, those physical barriers can reduce or improve some of the air quality in that neighborhood nearby. Temperatures are a good example too. You do see increased temperatures with a lack of green space or more impervious surfaces, and vice versa, or you see lower temperatures in areas that have more green space and shade. So I think those are options that we ought to be thinking about, we ought to be doing. And in my opinion, we ought to be doing more to assess the effectiveness of those interventions so that we know, what works the best.
Great. So I think the last question I have here is what the systems can do, or the level of approach they can use to reduce sources of air pollution in Greater Cincinnati.
So you're talking about sources, reducing sources?
Yeah, system level approach
System
to
level.
reduce sources. Yeah.
Well, I mean, there's always, cleaner improvements in how things are. Well, let me see if I can phrase this right. Lowering the levels of air pollution at the sources, I think, are a function of technology and improvements there. So I think there are things that you can do there. I think that you know we need the US EPA is considering reducing, or has considered, and is actually reducing the regulatory limits. And what that does is spur spur ideas and ways to make sure that people meet those regulatory limits. So I think that those are the advantages of large systems level changes or policies. Is enforcement is one way of breeding innovation. And so I would argue that would be something to think about there.
Great. Thanks for those answers. Next slide, please. Moving forward, what can you do? What can I do? Let's to kind of do a kind of climate resilient strategies to reduce risk of exposure. One, for individual, you can drive less, and be more sustainable. I mean, use more sustainable vehicles. Um, Adopt indoor plants and air purifier, as said by Dr. Patrick and Ryan. So you can also plant more trees and listen to local news, and also avoid outdoor activities during poor air quality. Then what institutions can do, which is on a system levels, in addition to what he has said, is local business and government should kind of adopt renewable sources of energy, fund more green infrastructure initiatives, developing actions to reduce exposure to toxic and air pollutants, adopting and enforcing emissions standards. So those are some of the highlighted system levels approach we think we can use to really reduce the poor air quality. So here I have some announcement which I would like to make, and we have few announcements. Includes can you move to next slide, please? So by August 20, which is tomorrow, we hope to do another webinar on food system circularity series, which we're going to be exploring the using of local food climate impact calculator. So it's the same time tomorrow too. On August 27th, we're going to be having like candidate education, which is going to center on sustainable actions in Northern Kentucky. And the second day, which is August 28th, we're going to be it's going to be applicable to Ohio folks, which is going to be sustainable actions in Ohio. Please register. I mean, go to our website and register for these events and try to participate. So for next month, is going to be our title is going to be on it's going to be on rank weeks. Sorry for that. So it's going to our webinar is going to be on climate change and rank weeks and health outcomes. So we're going to be exploring that and see how that impacts um, our region. So, and then September 19, we going to be looking at a webinar series, which is through Food Policy Council, titled "A Celebration of Our Regional Food System." So join our website to really and get engaged and get involved in what greater things, I mean, good things we are doing in our region. Thank you for joining us today, and hope you're going to join us by next month for another cool, exciting topic.